Excellent. All right. Well, thank you, everyone, and welcome for coming to the Shift Connect conference, our fifth session so far of the week. This one we'll be talking about transportation and COVID with Dr. Habib. I am Travis Nickel, one of the students in the conference course this year. On behalf of our class and professor, Dr. Rent Thomas, pleased to welcome you to this event hosted by the School of Planning at Dalhousie University. We are grateful to be able to live, work, and play on Mi'kma'ki, the traditional and unceded territory of the Mi'kmaq people. We also like to thank one of the Dalhousie University Elder in Residence, Jerry Musqual LeBlanc, who opened our conference with a blessing this year. She has done in previous years. It's always really great to hear her talk. We get more than just a line acknowledgement when we hear from her. We learn the importance of all being treaty people and get to share in her knowledge as well. We'd also like to thank our sponsors for the conference, the Atlantic Planners Institute, the Licensed Professional Planners Association of Nova Scotia, Turner Drake and Partners, FBM, Fathom, ZAP, and the Dalhousie University's President's Office. And as I introduced already, we have Dr. Habib here with the DalTRAC lab at Dalhousie University. Ahsan is a transportation professor at Dalhousie. He received his PhD degree in civil engineering from the University of Toronto in 2009. He held a professional position at the Ministry of Transportation, Ontario, prior to joining Dalhousie University in 2010, the founder of the Dalhousie Transportation Collaboratory, DalTRAC, under the Leaders Opportunity Grant Program of the Canada Foundation for Innovation. His research interests include travel behavior analysis, travel demand forecasting, and the microsimulation of urban systems. Dr. Habib believes multi-modal mobility options are the key to ensuring sustainability for Canadian cities. So just a couple little housekeeping things before we pass it over to Dr. Habib here. We are using the Zoom webinar software, so that allows just our presenters to speak. So if anybody has any questions for our presenter, in this session or the next one, you can put it in the Q&A box at the bottom of your screen. Upvote any questions that you really like and would like to see answered, and we'll get to them as many as we can at the end of Ahsan's presentation today. All right, so with that out of the way, I'm going to pass it over now to Dr. Habib.
Thank you very much, Travis, and everyone. Welcome to our session, and welcome to Shift Conference in general. Like, it's a very exciting time for our students, gathering a lot of people speaking about our challenges and opportunities. Today, I would like to share a bit of a novel new research that we are doing here at Dal since lockdown, COVID-19 and transportation. I will share at least 3 research projects and the results of it for you. So as you all probably know, our team, transportation research team at DAL, which is comprised of both planning and engineering students, we do a lot of data collection, travel demand forecasting model. And we were happy with that until last year, almost like a couple of days, almost a year ago, I would say, in March, when we got this stay-at-home order. Like, that changed quite a bit of dynamics among us. So, if I recall correctly, I came from Belgium for my visiting professorship on February 22nd. And there was a Shift conference going on, and there are some newer development. We didn't know at that time what lockdown is. We got some calls from some entities, and they were quite concerned. Maybe there are some issues of COVID infection at that time. It was this very stressful time, if I recall my March last year. And at the same time, we just got or anticipated an order that we need to close the entire research shop. So what we did in the first order business, we did the shift in our research agenda. Within a couple of days, first of all, I tried to buy 3 or 4 laptops for students to put in their home. And at that time, most of the shopping mall didn't have the laptop that we were looking for. And at the same time, I requested all PhD and masters and implant students to start revamping their research direction to understand the impacts of COVID-19 starting March. And 5 key areas we started working on is, one is the travel behavior. Second is activity pattern, what is that impact, or economic activities. And at the end, also auto ownership, land use, and emission and air quality. Today's presentation, I will focus on only 3 colored boxes that you see, some new research results that primarily focus HRM and its outcome. So what I will do in the presentation first is some background, our objectives, some methods, as well as results and discussion. At the end, I will conclude with some future directions that our team is going forward. So when we got this marching order from my fellow researcher at DalTRAC, we started looking at the literature. We looked at many influenza pandemic in last March, looking at, say, 1918 Spanish flu, 30% got sick, so we got scared, 10-year drop in average life expectancy. We tried to learn a lot from 2019 H1N1 and N1 pandemic. We found that shipyard, rail terminal, large workplaces and tram stations where things may happen. And at that time, I will take you through our thinking process. At the same time, it's not just the research we did right now. The research evolved as the lockdown and reopening strategies or various things was happening. So it's in a way very exciting to live with COVID-19, at the same time try to be happy with the data or information or digging deeper as we went through. COVID-19 initial report at the time came from the New York subway diffusion, because at that time New York got quite hit, and Harris 2020 really provided a good understanding of the spatial distribution of where COVID infections are happening in around March, April. And we learned a lot. So we were thinking there will be a lockdown or severe lockdown or other more options to contain that COVID-19 pandemic. And just a second, I can't see my screen. Now I can. So what we saw at the end, if you all recall, or even if you look at COVID-19 response in a way, this is mostly non-clinical solution until very recently when vaccine came through. And predominant approach that healthcare professionals actually took is restricting travel. So in every way, transportation planning is a part of it. Stay at home order, or you cannot do different types of activity. Some workplaces are closed. Most recreational discretionary activities are restricted. So it goes very, very much with the alignment of the thinking that we do activity-based travel planning or mobility planning. And we started looking at data, like we see travel patterns are going down, particularly from Google Mobility Report and Apple Mobility Report they were publishing at the time. And data was very scarce at that time, but we were looking at those things are happening. First of the order of the business, what we tried to understand in March and April, we started collecting data from Twitter, like what people are thinking about transport mode and mobility behavior. A couple of our other colleagues started doing surveys, but we thought this is probably most easier way to get into the understanding of what's going on, how people are thinking about transport modes and mobility behavior. So this is with one of my graduate student, Asif Hassan on ONIC, started downloading all the Twitter data And we tried to develop some sort of a research objective to understand the effects. And we were also thinking at that time very forward looking, there might be some reopening, and what will be the reopening challenges and opportunities. And we use techniques of social media data mining for that. The way we did, I will not go into the details of the methodology, but we tried to tag and downloaded all the tweets, publicly available information that has the keyword sets like public transit, cars, bicycle, and reopening, these type of words. And then we use a more qualitative research techniques to categorize them into themes, doing some text mining techniques to identify frequent words, and topic modeling to get more deeper into problems and solution matrix as we move forward. So here is a table like that demonstrate the number of 600 tweets. We went deeper for each of those items like public transit, bicycle, car, and reopening. Those are the major areas of focus. And you'll see there are percentage of like what people are chattering, what people are talking about, what are their concerns. So public transit, most of the concern was like how we can reopen. People were very optimistic, even when we are reading those texts. They were looking for improvement opportunities. They were very concerned, 11%, on transit worker challenges, like how to save them, and ridership challenges. Those were the predominant theme on the public transit, but there are others as well, economic impact. And so for bicycle, like people were thinking, oh, people might like cycling over other modes, or they were already preferring cycling over other modes. They're also talking about improvement opportunities. Bicycle sale was increased in that reported case. And by the way, this tweets are from all over the world. It was not restricted to HRM or Nova Scotia, but we tried to like take at the end for the analysis for this particular paper only North American information. They were talking about health benefits of cycling, how that can help during COVID. And we are talking about March, April, and May, that the time of that public discourse. For the car, like how reliable the cars are. Those are the predominant discussion. Car is safer. Prefer car over other modes, those type of things. People also put like, oh, since we are not driving, maybe greenhouse gas emissions will be reduced. So those discussion people also having in those. For the reopening, again, strategies for safe reopening, like whether we'll reopen, do not reopen schools was 10% of that discussion. So there are a lot to learn, but this gave us some direction for even research ideas, what we really need to look at more deeply as we move forward. Some of the word cloud that you can see for the public transit and COVID, mandatory mask was the discussion in those tweets. So the larger the text that you are seeing right now, the more mention of those items were on those tweets of different kinds. For the bicycle, it's interesting to see that the public transit became a bigger issue. So we'll not use public transit, for example. People are saying we'll go for bike or other kinds of things. Same thing happened in the car. We collected those information. Car is safe. That was like the predominant theme as we move forward. Reopening, people were very cautious. New cases may happen. Schools, businesses were also in the big discussion. We went a little bit deeper with topic modeling, which like does some sort of a mechanism to provide the probabilities of what kind of main topic area discussed on those texts, which is giving similar kind of understanding for us that pandemic, we need a mask, similar kind of guidelines requirement, but it goes a little bit deeper. So we did for public transit, we did for bicycling, we did for car, we did for reopening again, just to understand what's those thought process giving us. So at the end, which I'm more proud of, is we came up with this problem solution opportunities matrix based on those comments, like what are the major problem from the perspective of the users. The first, public transit is risky to use during pandemic, and nothing is very much different than common knowledge, but there are interesting discussion there as well. Not enough space for cyclists, pedestrian, traveling to and from workplaces have high chances of getting COVID-19 affected. Lockdown has adverse effect. So those are the economic loss for transit operators are a couple of problems. And then we started looking at what people are talking about solutions and what are the opportunities moving forward. So just a quickly giving an overview of what we get is some public transit risky, some other modes can be used, cycling infrastructure needs to be improved. But most importantly, I will highlight this working from home. That became one predominant discussion and an untapped resource. Sometimes even in some conferences I was discussing that transport planners were advocating for travel demand management, particularly telecommuting, for a long time. But this is for the first time, despite initial opposition, users embraced working from home and online living, online learning, and online productivity has become a thing. And that was like one highlight of the research, I would say, from this. There is also some mention of this mental health issues, but I will go more on the economic loss of the public transit. That's where also a lot of discussion, and even later on, we have seen some of those discussion in the transport scholarly world, like there needs to be some way of restoring, reshaping, and improving transit system. There will be perceived risk or even real risk as we move forward. So there needs to be a lot of thought process needs to go through for moving for transit transit improvement. So once we got those public discourse discussion, we learned a lot. We presented this in this year's Tier B, but at the same time, we started drilling deeper, like to really understand what's happening in Halifax. So those are the perspective of the users. Now, what can models or numbers tell us about COVID-19 scenarios? So that's lead to this second work that we said, and we were lucky, like in certain way from a research point of view, and that's very exciting. We had a activity-based travel demand forecasting model made for last 4 or 5 years. Our students were working on, both planning and engineering students, and the way we did in that model for HRM is, instead of taking trip-based approach, which is a traditional approach for last 30 years for a classical 4-stage model, we took the activity-based modeling approach, meaning we are modeling what activities people are doing, when they are doing, where they are doing, with whom they are doing, what mode they do, and which car they were taking on those. So there are two significant differences from many other activity-based models around the world, I would say. One is with whom. So we know shared travel, that is one of the concerns for COVID-19. So that's a very important attribute of our model that can give us answers to what's going on for shared travel. And also which car, like van or engine type, that kind of things give us the emission estimation. So we are very proud of that our model was operational at the time to start testing scenarios, real world scenarios during COVID-19 lockdown. So what we did, so this is just a modeling framework, which we do. I can give a very quick snapshot, 1 minute. So what we do in this model, we synthesized 500,000 population of HRM, meaning we have rows of each person with their attributes. We synthesize that from census data. Each person, we generate the activities based on our DalTRAC survey, like what activities they do, work trip, mandatory trip, going to the doctors, eating out, those type of things. Then we schedule them. We find a destination choice, with whom they are going, which mode they take, and which car they take. So it's not exactly we are say simulating REN in the right place, but we are probably, I'm just taking REN as an organizer, but we do quite well can identify is a particular person or agent with that type of attributes for each zone or parcel that we work on. So that was our model prior to COVID. So it was easy for us to test scenarios simply by turning off, like I'm simplifying in certain way, turning off, say, all the discretionary activities, going for eating out, all the recreational activities, or adding more long distance visit to park, those type of things. So that this model was just perfect to do activity restriction, which is COVID approach for tackling the virus in general. So what we did, we created these 5 scenarios. One is the business as usual scenario, pre-COVID, which we already had. And then we created from March 22nd to April 30th, it was the lockdown scenario. And we were working during April time of this research. We were thinking then the reopening phase 1, reopening phase 2. And at that time, the Canadian government also came up with their dates for what will be the likelihood of this phase 1, phase 2, and phase 3. So we tried to get those. And the numbers that you are seeing, auto trip decreased by 38% from lockdown, was coming from our Google report, as well as Apple report, and some data fusion that we did. So we tried to generate exactly, or as close approximation as we could for HRM, like what is going on in terms of overall trip, and we applied to the model. So this is our business as usual percentage of activity type in HRM for all population, say 20% work, school 7%, shopping 21%, and personal business. So you'll see all of those activity, frequency, mode choice, shared travel, vehicle allocation. That's generally what happens. Those we came from our DalTRAC Halifax 2018 survey, and we mimicked that. So that's how we validated the model. But when we applied our scenario, now we can see what's going on overall for the city. So for the HRM, and these are really fresh results for all of us, and we are still interpreting the results. So for the lockdown scenario, 47% reduction of activity participation for in HRM. 23% for the phase 1, phase 2 minus 20, the reduction of 10%. In reopening phase 3, which is almost normal, we are predicting activity will be 3% more than the business as usual case. So similarly, you can see in the next figure, it's activity participation by category. We also tried to display them or visualize them in GIS, and try to understand spatial distribution of the mandatory activities, maintenance activities, and discretionary activities in HRM. Mode choice is interesting. So you can see on the left-hand side, our prediction based on the model that we have is lockdown 46% was a reduction, phase 1, 14%, phase 2, 5%. But in the reopening phase 3, which is almost normal, we are predicting that auto use will be increased by 13% from the business as usual. For the transit and active transportation mode choice, you can also see like it was reduced significantly. Initially, it was 9% and later on 8%. But we are predicting that in any reopening stage, there will be 3 to 4% in the range. So there is a lot of thoughts needs to go in HRM or with the province or with the federal government to really think through how we can reshape, restructure transit so that we can bring back the ridership that might be happening. Active transportation, many of us probably was very excited. It went up in the lockdown time because that's more personalized and people were using those for other purposes, not maybe for the work purposes. But it also remains 9 to 10%. So it might not remain the way we saw during the lockdown. we again try to go much more deeper, understanding the travel distances by age and different socioeconomic categories. I will not go too much into that, but shared travel prediction that we have for from this model is in the reopening stage 3, people probably traveling more with households and non-households member, but traveling alone as well, but not as much with other. So ride sharing or shared travel could be at risk for us. So that's another sustainable transportation approaches we were trying for a long time. So that's another area of concern that needs planning interventions as we move forward. Vehicle allocation, at the same time, you see the last column, last part of the figure, reopening phase 3. That's where I'm looking, because that's what probably will go in this fall or sometime there. So compact car use is subcompact car use is less than a compact, mid-size, or SUV and van. So maybe the gain that we made from the greenhouse gas emissions, which is an indicator for all other pollutants, maybe that will disappear. At the same time, actually, that will increase more. So there needs to be more work to go back in our discussion on sustainable transportation and other approaches. So once we have done this travel or activity related data analysis using the same model or its outcome, we started looking at what is the economic impact. And in this case, we mainly looked at the retail industry. So what we tried to do, use the data of the activity participation, where people are going, what type of things they are doing, and used a very rich data set of Info Canada business establishment data. We have 11,000 HRM establishment with their annual sale during normal time and employee size and different kinds of information. We purchased that data set a couple of years ago for parking study. Sometimes things pay off later on. And we use that and use a more regression model where our dependent variable was yearly sales. We took the log version so that we can see the differences. But the independent variables were business attributes like employee size, for example, or which industries are operating under restrictions, and use mobility attributes, which are our model outputs, mostly how many auto trips, how many recreational activity trips and shopping activity trips. And we use also built environment to see some differences of population density. And based on that, what we found is during lockdown time, retail sale has gone down 87%. And this is, sorry, since these the conservative and aggressive is the reopening 1 and reopening 2. Two research was going in parallel, and that naming convention was different, but it's essentially the same. But reopening 1, 71% loss persists. Even reopening 2, when most of the things were open, is minus 60%. So retail sector, we based on our work, is suffering a lot and continue to suffer as we move forward. We also tried to understand rural, urban, and suburban retail, and there are some interesting understanding here too. You'll see initially the urban lockdown period, the urban retail got more affected in comparison to suburban and rural. But you'll see the more we ease restriction during our reopening phases, urban retail regained faster than the rural, than the suburban in particular, and rural in certain way. So we are learning more and more with this data, trying to really understand why these things are happening, whether or not our predictions are quite right. We are trying to validate as more numbers coming in from government agencies, but we are moving forward, learning more and more. We again try to visualize them during different reopening scenarios, and also trying to come up with strategies like what the HRM or other agencies, or in general, whether these are applicable in other cities. That's what we are looking at or writing about. We are very proud to report that this type of very local level detailed microsimulation based models are very limited in most academic institute or in our peer with our peer labs or other places. So we were very much appreciated, at least like finding out ways, methods on what's going on there. So in conclusion, what I would say that shifting our research agenda really paid off. We enjoyed this journey and kept ourselves sane during this unprecedented time. We tried to excite ourselves with trying to working on the real world problem and trying to understand. And we are partnered with HRM and Department of Municipal Affairs, and we'll soon start a more practical recommendation building or more practical partnership to see how different agencies, municipalities can really take advantage of the research that we have done. And I already mentioned this is quite unique level of local level empirical research that uses activity-based travel demand forecasting model. And 3 or 4 papers on this research has already published in peer-reviewed journals. Impacts are evident in travel mode, mobility patterns, and economic losses. Right now, we are working on more in the street level. What is the traffic flow and emission happening given these different scenarios? We are also looking at if there will be any long-term impact on decisions such as residential location, auto ownership change, as well as business closure. And very recently, we started another work because COVID-19 may come back or similar kind of things may come back. We are trying to combine more epidemiological model with travel model to see if transit can work as a vector and what may happen, those kind of things. So we are trying to learn as we move forward with the data information and also challenging research question. Couple of our M-Plan students are looking at interviewing folks, the business owners, for instance, to understand what's going on, whether our empirical research can be validated from those for qualitative research as well. So we are trying to inquire as we move forward. And thank you for listening. I'd like to thank all the funding agencies, particularly NSTAR COVID-19 Research Grant, which was given to us right after 3 months when we started that work. That we are thankful for that. But most importantly, I'm thankful to all my terrific graduate students and coordinators who really put their heart and soul in data digging, as well as inference building and writing papers throughout this COVID time. Thank you very much. Questions?
Excellent. Thank you very much, Dr. Habib. I'll just let everyone know again that if you have any questions, just to put them in the Q&A box at the bottom of your screen there, and we'll get to them as best we can here. We do have a few questions we've got lined up. We wait for questions from the audience here. Not just the effects of COVID itself, but is there anything that COVID has highlighted in terms of opportunities within transportation systems?
Sorry, Travis, like I was frozen for a second. Can you again telling me the question?
Yeah, no problem. So aside from just the effects of COVID itself, I wonder if you could speak to any of the challenges, opportunities that COVID highlighted that already existed within transportation systems.
Yeah, very good question. I think a couple of, like, number one, we do not have a coordinated response mechanism for any type of public health emergencies that includes transit agencies or transport agencies. We do not have that. So it's not simply for COVID-19, but we are not prepared for, say, mass evacuation for hurricane or others. It's public health, or whenever an issue comes, that particular department or those folks are responsible, and that does not create a good solution. So that's number one from a governance point of view, not probably from transportation point of view, but governance point of view. Number two, I would say we are too much dependent on one or two mode type, say car and public transit. There is not diversity of, say, active transportation, walking, biking. Those are not available. We have not invested enough. So social distancing, two of my students, I actually excluded those slides from this presentation, worked on the auto airport and Spring Garden, how we can implement social distancing and still have a vibrant retail. So they did some sort of a pedestrian simulation, and it shows us like some of those are simply not feasible, even with the improvement planned, right? So there are structural deficiencies of our mode market, mode mix. And this is highlighted by COVID-19 much more bigger way. So those are, I would say, the two major area like that opened my eyes for a problem side. Yeah. For the opportunity side, if you look at what I understood, for the first time, we learned that there is an untapped resource, which we call working from home, the TDM strategy. This is like this, and it's possible, it's doable. It does not destroy productivity. Like I believe many sectors, of course, for some sectors, the experience might be different, but for many sectors, like telecommuting or compressed work week or use of virtual technologies to do work, like even for shift conference to have this way, like was never been realized, and not traveling is possible to do or participate in activities. This is one key lessons for all of us, I would say, and it's important lesson, and hopefully we'll carry forward that as we move forward.
Excellent. Yes, thank you very much for that. I think another question I have would be, with the pandemic, we do see a lot of reduced use and almost trust in public transit, just with kind of the worry of spread. Is there any tactics or ideas you think that could be utilized to rebuild or that trust and use of public transit?
Sure. I think this is $1 million question. This is $1 million question, but I can report on some of the discussion going on in scholarly circles, and also like our thought process in here and there is at least two ways we should probably tackle this distrust. And it will continue no matter like if like every herd immunity or vaccination happens by say September or end of this year. It will remain like there will be some trust issues. So two approaches like that we can at least right now think through. One is revamping our current system, like meaning more disinfection, more investment on transit or on those guys. But I will bet on my second approach, which is another untapped resource transport planners are advocating for a long time, is this micromobility, microtransit. So there might be an revolution or an evolution of our transit becoming more personalized, pod or compartmentalized, long distance traveling. So I think that probably will evolve at some point when we need to support that kind of system as well. But that will not happen within, say, next 2-3 years. It will take time, that kind of evolution or disruptions of the system. For now, I would say federal government, municipal government, and provincial government needs to really start thinking through and talking through like how they can improvise our existing transit system and how that become a different retrofits of vehicles, very small retrofit, circulation plan, and various other ways of bringing back that trust. Otherwise, transit will be in trouble. That's what I strongly believe.
Excellent, thank you. And then I also wonder if we kind of look at it from the other side as well. With government systems, there often seems to be this chicken or egg thing with transportation, where they want to see demand to fund it, but it needs funding for demand. I wonder if you see from that end any process or way to continue investment into public transport.
Yeah, that's a problem. But I will add another bigger problem in that chicken and egg circle. Like we have probably chicken, egg, and something in between, which is too long. We are really living too far away from the activities that we participated in. So unless we start looking at the land use issues, our origin destination pairs, right? Living closer to your work, or really building near to high density areas, or agglomeration of multiple activities in one place, so that creating destination hotspot and origin hotspots, this problem will remain. So funding problem and ridership problem, yes, that's immediate short term that we see, but there is this fundamental issue which separates us from Europe, that separates us from many successful cities with public transit or active transportation oriented living or livable city, all the big or bright thing that we talk about in the urban design side, that probably needs to be addressed as we move forward. There are some risk though, as you might probably heard a bit from Jennifer Kismet's presentation a couple of months ago, is if there is this like moving farther away from what you do now because of COVID, that could be another problem that also need attention by city planners right now. There is a risk of those. So that's why you saw probably our fourth pillar is trying to understand like whether people will be moving away because they are working from home, or moving away because the concentration on density has something to do with COVID-19 infections or variations or something going on, right? So land use planners have a lot of things to do to improve transport planning. In fact, more than what transportation planners could do. That I strongly believe. And that's where like things needs to start shifting through public agents, private agencies, building near to like activity centers, or building more complete communities, so that like you have other activities, maybe for work you can travel, but other activities, your discretionary activities, your dentist appointment, those type of things. So I think there needs to be all the good things that we are talking about, urban planning needs to happen again now, and more so that we are prepared for this type of crises. We can really thrive. If we are simply scared away from what COVID is giving us, I don't know what we'll do when climate crisis or other extreme weather events, or so things can happen. Like I think another thing, like Travis, if you allow, what I learned, and many people probably learned, is things happens. We thought like disruptions, like massive disruptions of human life or human activity probably will not happen. This is no more Second World War, First World War, or big disruption. But today we learn things can happen. Independence Day movie can happen, right? So that's where like that good planning practices comes back. That so that we are prepared for different types of threats altogether. And that's probably both government, private citizens, and public agencies should start, nonprofit should start thinking through, like we need to prepare ourselves to survive and thrive as we move forward.
Excellent. Yeah, that's definitely a lot to chew on that one. I see you unmuted yourself, Ren. Do you have a?
Oh, I was just going to point out there was a question in the
Oh,
chat.
sure. Yeah, I'm just going to read that one. So we have a question here from Michael. He said he'd be curious to know if transit ridership figures in HRM since March 2020 have diverged based on the area of the municipality or route. He asked this because in Toronto, some routes in the northwest and northeast parts of the city have seen ridership figures recover more quickly, as a lot of frontline workers tend to live in those areas than that on subway lines, which apparently tend to serve areas with more people who can work from home.
Yeah, good question. But unfortunately, we have not looked very deeply on the spatial distribution of transit ridership yet. I think like you're probably right. What Toronto is seeing probably will have some sort of similarity, but I'm not able, from the research that we conducted, we do not have that being looked at. But I will keep that research idea for the next project for sure.
Definitely. So I'm just looking through the questions I have here then. I wonder if you, at any of your research, if you've if there's been any thought about essential workers, such as like even just the bus drivers themselves, or those that relied on public transit and working from home was never an option given the type of work they did, how the changes in transportation systems have affected those groups of people.
Right. Good question. So I will answer in two ways. Yes, in our model, we considered them like using public transit and other modes, and that's why you saw even in the lockdown time there was use of public transit and other from a percentage point of view. So we utilized that in our model, and we tried to take into account like how that's going on. But I will go in a second piece. In municipalities or by transit agencies, there were not enough effort to really think through how we can facilitate essential workers, how we can facilitate particularly captive transit riders, given this particular risk of getting COVID during using public transit. There is not enough done throughout North America, like not particular only this city. So there needs to be more thoughts. I think I hope the disruption that we have seen will give us opportunity to think through. There are times some people need to move for other people to stay alive and healthy. And this is COVID situation, but it can happen even during mass say hurricane, if hurricane comes in, if flooding comes in, if mass evacuation required. Do we have in Halifax an evacuation route so that the essential workers or fire brigade trucks or police cars can get in and out from the city in the peninsula? The answer will be no. We do not have those, even for smaller things. An explosion, we know explosion happened in Halifax in the past. And what is the preparation for that? Is there those backup plan, the contingency plans? Do we have those emergency plans in place? We have policies, we have procedures, but do we have a plan in place? The answer will be no. So question is, yes, we need to start thinking through, particularly who keep things running, the electricity, the healthcare officials. Those are kind of like, we now learned like who really are important in our life more than ever, and really make plans, documented, tested, and drill off. Like COVID-19 should be a wake-up call to do more and more drill for crises, and this crisis may happen. So I would say there are a lot of planning needs to be done to facilitate all of those emergency services. And public transit in particular, because some people are just captive transit riders, not choice riders.
Definitely. And this is just a question of my own curiosity here. It might fall a little out of the scope of the work you did, but I'm curious about during the pandemic, especially I find in Atlantic Canada, with the bubble we had, whether the transportation systems in more rural places saw greater strain with more people staying within their home and doing more of the transit via car and less travel away via airplane and things like that. I don't know if you have any thoughts on that.
Yeah, that's important. We have not researched, but that's all like and a very important one, the rural transit, both intra-rural as well inter-rural. And this probably will go back to your first question, Travis. I think we probably also learned one thing. Since our rural areas, we are seeing the youth, the younger population is going out of those rural areas. There are more limited people like that can give rides to those who needs more rides as in times of need, like the doctor's appointment and other kinds. So, we don't have those kind of things. So it really showing those rural areas how vulnerable for the intra-rural movement. But now if you bring that interzonal, meaning from rural to other places or provinces, you were absolutely right. That's a one big ball game. Like we are all staying home or stay in the provinces. I can see some opportunities though. Maybe Nova Scotia or Atlantic bubble or Ontario bubble. We'll start looking at or visiting places nearby instead of trying to go for vacation in Florida or in other places. So there are some opportunities may come. Maybe rural areas will be more attractive places to go if we do that good branding. But at the same time, I do totally agree. Rural areas probably suffered more than the urban areas, which has not been researched well or even documented well or talked through well. That's an important area to discover.
Excellent. I see we're getting near the end of our time here. We like to try to generally end the sessions on a pretty positive note if we can. So let's finish off with any kind of what you think the biggest opportunity and upside of the conclusion and consequences of COVID, and any final thoughts you may have for us today.
Thank you, Travis. I would say working from home is a new discovery. Let's utilize it effectively with better guidelines, better support for employers, for better support for businesses, and take advantage of the amount of greenhouse gas emissions that we save. At the same time, commute stress, and mix it in a good way, so that we thrive at the same time we move. And instead of building more roads, let's build more better infrastructure for connectivity, broadband connections, rural area hard hit on that as well. So I can see telecommute, working from home, mixing it with our movement to enjoy like socializing in the workplace and others could bring a tremendous opportunity and tremendous benefit for the environment, for our productivity, and also truly becoming a physical virtual person. I think information and communication technology has more to offer than Facebooking and Snapchatting or Instagramming. We learned that let's continue with COVID, that we can do productive work in a way and also contribute reducing our carbon footprint. Thank you, Travis.
Definitely. Well, on behalf of the SHIFT conference organizers and our professor, Dr. Brand Thomas, I'd like to thank you again, Dr. Habib, for that presentation and all the great answers to the questions today. We're now going to move into our next session that's starting right now. It'll be our rural transit session as we move into our next one here. I'm just going to keep this brief for those of you that are still with us from the last session, but for those of you who are just joining, I'm going to welcome